بسم الله الرحمن الرحيم وبه نستعين والصلاة والسلام على رسول الله. Sisters and brothers, assalamu alaikum wa rahmatullahi wa barakatuhu. I would like to start by expressing my regret for not being able to talk to you directly. I have to talk to you by video because of circumstances beyond my control. My discussion today is about medical ethics from the Islamic perspective. I feel that the time has come that Muslim physicians and nurses and other health professionals should understand medical ethics from an Islamic perspective and also try to disseminate this perspective as much as possible, because our profession is facing a lot of ethical problems today. And these problems are going to increase as medical technology comes up with new technologies that challenge existing moral understandings, moral principles. We need to be able to say what is the Islamic point of view about these technologies. Ethics in the Western world is based on various theories, is based on various principles. I've been studying them for the past 20 years or so, and I found that there were gaps in these theories and these principles. I do not want to go into the details of what these gaps are. I have written about them. You can read on my website. What I want to do today is to present the Islamic alternative in medical ethics. We have got an ethical theory in Islam. This ethical theory is based on what are called the higher purposes of the law, maqasid al-sharia. So the maqasid al-sharia are a theory that enables us to tell what is right, what's wrong, what's moral, what's not moral. The maqasid al-sharia are five. There are five basic purposes of the law. And if we practice medicine, fulfilling them or not contravening them, we are practicing medicine in an ethical way that is accepted by Islam. What are these five purposes? The first one is called hifdh-ud-din, protection of the deen or of morality. As health professionals, we should never do anything that violates the religion or violates morality. And by morality I mean the common morality that all humans share, because all of us are able to tell what's right from what's wrong, except in a few things in which we need guidance. The second purpose of the law is hifdh-an-nafs, protection of life. When you practice medicine, we should make sure that we do not harm human life, we do not harm human health, either in the present or in the future or in future generations. The main purpose of medicine is actually revolves around this second purpose of the law, hifdh-an-nafs, protection of life and health. The third purpose of the law, that's part of this theory or ethical theory of Islam, is hifdh-an-nasl, protection of lineage, family. So when we talk about pediatrics, we are fulfilling this purpose of the law. Obstetrics, we are fulfilling this purpose of the law. Taking care of children, we are fulfilling this purpose of the law. Making sure that the families stay together and survive, we are fulfilling this purpose of the law, hifdh-an-nasl. The fourth purpose is hifdh-al-aql, protection of the mind. The human being is different from other creations of Allah subhanahu wa ta'ala in that he has got a mind with limited freedom. So the human has to use their mind very well and correctly. Now, if this mind is sick due to mental illnesses or due to diseases of addiction, it cannot function as Allah wanted it to function. So any treatment of mental illnesses, treatment of stress, treatment of addiction fulfills this fourth purpose of protection of the mind or hifz al-aql. The fifth purpose of the Sharia is hifz al-mal, protection of resources. Medicine fulfills this in various ways. First of all, by treating patients so that citizens become healthy, they become productive. This contributes to the wealth of the country. But also, in the hospital and other healthcare facilities, we need to conserve resources and make sure we do not waste anything that is needed for treatment of other people. So these are the 5 purposes or maqasid sharia that are the theory that will guide us to see what is right and what's wrong, what is ethical and what is not ethical. Let me emphasize at this point a crucial difference between the way we look at ethics and law in the Islamic perspective and how in the West they look at ethics and law. In the West, ethics and law are 2 separate disciplines. And the reason for this is that during the Renaissance, about 400 years ago, 600 years ago, there was a separation, what we call secularization. There was a separation between religion, which is the source of morality, and public life and public law or positive law. When, in the recent years, medical technology came up with issues that require moral judgment, the law that has been developing in the Western world over the past several centuries was not able to deal with these issues. Therefore, the discipline of ethics became prominent in order to handle these ethical or moral issues because they were not provided for in the positive law that is known. In Islam, we do not have this problem. In fact, the word ethics, translated in Arabic as akhlaqiyat, should not exist if we speak strictly. Because in Islam, our law, the Sharia, is all-encompassing. It has got the positive law, but also has got the moral guidelines. So when we talk about medical ethics, we basically are talking about the Sharia. It has provisions for any problems that we may come across as we practice medicine in the hospital and other healthcare facilities. Now, I want to go on to talk about ethical principles that we use in our profession, again, from the Islamic perspective. They are very encompassing and very wide and very practical and very robust. The first principle is the principle of intention, قاعدة القصد. It means that whatever you do is judged by the intention behind it. This implies that a Muslim healthcare professional will check in his heart to make sure that what he or she is doing is moral, is ethical, regardless of whether other people see or know that he's doing something wrong or right. You check yourself. This is the basis of an inner conscience, قاعدة القصد. The second principle is the principle of certainty, قاعدة اليقين. A Muslim health professional should not take any intervention without having an evidence base for it. This is the base of evidence-based medicine. It's قاعدة اليقين, the principle of certainty. We must have clinical evidence, we must have laboratory evidence, radiological evidence before we take action. The third principle is قاعدة الضرر, the principle of injury. This principle says that whatever medical procedure we undertake, we have to compare the advantages, al-maslaha, with the harms, al-mafsada, and make sure that the advantages, al-maslaha, far outweigh the disadvantages, side effects before we undertake the procedure. In any case, if the side effects If the harm is more than the benefit, we do not undertake the procedure at all. In some situations in which the benefit and the harm are considered of equal worth, we are conservative. We do not undertake the intervention because it's a principle of Islamic law that dar'ul mafasid muqaddamun ala jalbin masalih. Preventing harm has higher priority of consideration to bringing about a benefit. The fourth principle that we use is called qadat al-mashaqqa, the principle of hardship or difficulty. This principle makes the practice of medicine very easy in the sense that when there is a situation that threatens life, what is haram can become halal so that we can save life. For example, it is our law and our culture that we cannot look at the nakedness of another person, especially if that one is from a different gender. But under this principle of hardship, because there's a barura, there is a necessity, we are allowed to do that. So this is a great principle that makes the practice of medicine very flexible. The fifth principle is called qa'idat al-urf, the principle of precedent or custom. This is the basis of abiding by consensus guidelines in treating or managing various conditions. Because in Islamic law, al-urf or al-ada, something that is customary, something that is accepted by everybody in the profession, has got the force of law. Al-ada muhakkama. So a Muslim doctor or nurse or any other category of professional must respect the existing practices within the hospital, because according to our religion, they have got the force of religion, the force of the Sharia. Now, as I conclude, I would like to summarize the basics of the practice of medicine from an Islamic ethical perspective. I said that there are 5 purposes of the law, maqasid al-Sharia, that constitute the theory that will tell us what's moral and what's not moral, what is ethical and what's not ethical. And these principles, these purposes are protection of morality and religion, hifdh al-din, protection of life and health, hifdh al-nafs, protection of the family and lineage, hifdh al-nasl, protection of the mind, hifdh al-aql, and protection of resources, hifdh al-mal. Thank you very much for listening to me. I look forward to meeting you on several occasions in the future so that we can discuss medical ethics from the Islamic perspective and talk about ethical dilemmas that we find in our daily practice in the hospitals. Wassalamu alaikum wa rahmatullahi wa barakatuhu.